Welcome to Medicaid Made Easy, Understanding Medicaid for Children with Disabilities. This online training was made by Family Voices of Wisconsin to answer your questions about Medicaid. Family Voices of Wisconsin designed today's training. Family Voices is a family-led, state-affiliated organization that is part of the National Family Voices organization, promoting quality health care and long-term supports for all children and families, particularly those with special health care needs and/or disabilities. Their work is focused in the areas of education, family leadership activities, and public policy. Before we dive into the content of today's presentation, I want to offer a context of who is providing this training. The Wisconsin Department of Health Services, through the Division of Public Health, supports programs that serve children with and without special health care needs. As you can see, we represent a wide variety of programs and services throughout the state of Wisconsin. There are 5 regional centers that are part of the Children and Youth with Special Health Care Needs Network. Staff at the regional centers know about many resources in your community and can answer many of your questions. Often, regional centers have family members as staff, and they are able to relate to many of your concerns. If they don't have the answer, they will find one for you. In this section, we're going to give you the information that you need for a basic understanding of the Medicaid program. You'll learn about the program, how it's funded, and what it looks like in Wisconsin. This section answers questions that people who are new to Medicaid may have. Medicaid provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by states according to federal requirements or rules. The program is funded jointly by states and the federal government. Yes, Medicare is for adults with permanent disabilities and/or over the age of 65. Medicaid, on the other hand, is a needs-based health care program for people with low income, including pregnant women, families, children, and elderly, as well as people with disabilities. Some children may have both Medicare and Medicaid. For example, children may get Medicare if their parents are deceased or retired. In a sense, we all fund Medicaid through the taxes that we pay, but there's also a structure to how Medicaid's organized. Funding comes from the federal and state governments working in partnership. Medicaid programs have requirements and processes that families need to follow to get and keep this health insurance. The federal government pays each state a percentage of the program costs. Each state then adds money and administers its own version of Medicaid. In Wisconsin, the Medicaid program is managed by the Department of Health Services. For families, it's important to know where this money comes from to understand how to access Medicaid services and supports for their children. The goal of Medicaid is to provide basic health care services. Some of the funding for Medicaid comes from the federal government. It's also partially funded and managed by individual states. This means that each state has a different Medicaid program. In Wisconsin, the Medicaid program is managed by the Department of Health Services, and compared to other states, it has a broad range of services. A lot of families have both Medicaid and private insurance coverage for their children. Coordinating this coverage can be confusing and raise questions about how claims will be paid. The most important thing to know is that Medicaid is the payer of last resort. That means that all claims must be billed to private insurance first. If private insurance has denied payment of the claim or paid only some of the claim, then Medicaid will be billed. Medicaid can also be used to pay co-pays from private insurance and may pay for therapies and services that your private health plan won't cover. Your child has a Forward Health or Medicaid card. Now what? You may not know what this card is used for, so we're going to go over the basics, including the services and supports that might be covered to keep your child living safely at home. It doesn't matter which door you use to get Medicaid. The Medicaid card benefits are all the same. Medicaid card benefits are the goods and services that are covered by showing your Forward Health card. When your child's Forward Health Medicaid card arrives, put it in your wallet and keep it with you at all times. Then show the card at each of your child's appointments and at the pharmacy for prescriptions. At appointments, providers will ask to scan your card to make sure that you or your child are still covered. Also, remember to ask if the Medicaid card will cover any new therapies or medications that providers recommend for your child. If not, providers will most likely work with you to find alternatives that are covered or try to get approval for their recommendations. This is a list of mandatory services provided in the Wisconsin State Medicaid Plan. The federal government only requires that each state offer the services in red for its Medicaid plan. Clearly, Wisconsin has more than is federally required. At any time, though, the state legislature can change the Wisconsin State Medicaid plan. So it's important to stay informed about legislative activity regarding the services that your family uses. If your child is eligible for Medicaid in Wisconsin, she or he will be given a Forward Health card. This card can be used for routine medical services. It can also pay for things that a child with a disability or special health care needs may need to continue living at home. This includes items like diapers for children over 4 years old, over-the-counter medications, or services due to medical necessity. The Medicaid card can also pay for personal care services to help your child with activities of daily living in your home. Your regional center can help you identify a home health agency in your community to provide personal care services. Medicaid offers a broad range of benefits for children known as Early Periodic Screening, Diagnosis, and Treatment (EPSDT) services. EPSDT is really important for children with disabilities because private insurance often doesn't meet all of their needs. Unlike other health insurance plans, Medicaid also covers long-term care, including nursing home care and many home and community-based long-term services and supports with the goal of keeping your child in your home. These services, given in the home or community, let people with disabilities live independently rather than in institutions, and account for more than half of Medicaid spending. In Wisconsin, EPSDT is called Health Check and Health Check Other Services. Health Check Other Services is a useful way for your child with Medicaid coverage to access services and supports like mental health services. This includes residential and day treatment programs when there aren't other coverage choices. To get these services, your child's doctor will need to do a health check annual exam or screening that shows that mental health or behavioral health services are medically necessary. Medicaid can be used to cover mental health, behavioral health, and substance abuse related supports and services. The programs supported by Medicaid are county-based, so there can be a lot of variation in different parts of Wisconsin. These programs, like coordinated service teams, known as wraparound programs, and comprehensive community services, are meant for children who have more complex needs. If you feel that your child needs this level of care, call your county's Department of Health Services to learn how to get an intake started. If your child has a Medicaid card and you need help getting to his or her medical appointments, you can contact Medical Transportation Management, or MTM, 2 days before the appointment to set up a ride. MTM services are only meant to be used if you have no other way to get to your child's appointment, so the person scheduling the ride will ask about this. Don't be afraid to let them know if it's hard for your friends or family to drive you and your child. Allow extra time, as much as 2 weeks, if it's your first time using this service. You may be asked for a prior authorization or extra scheduling time for more rural communities. Our Family Voices fact sheet on non-emergency transportation gives more detail on this useful service. Some children use diapers or other incontinence supplies for longer than typically developing children. Some children use them throughout their lives. The medical term for diapers is incontinence supplies. Wisconsin Medicaid will pay for diapers and other incontinence supplies for children ages 4 and older. This includes briefs, or diapers that open on each side, and pull-up or pull-on type diapers. Incontinence supplies also include disposable underpads, liners, disposable gloves, catheters, skin barrier swabs, lubricants, and other related supplies. To have these supplies covered by Wisconsin Medicaid, you must order them through J&B Medical Supply. J&B Medical Supply will deliver the supplies to your home every month. Personal care services allow a person to live well and safely at home. Personal care services include tasks like feeding, toileting, bathing, dressing, light housekeeping, laundry, and meal preparation. There are Medicaid rules for using personal care services. For example, the child or adult must have access to Medicaid, have a forward health card, and need these services for medical reasons. Medicaid must also approve the agency and your family's care plan before services begin for your child. If you think that personal care services would be helpful, contact your child's primary care provider or case manager to find available agencies in your area. The agency will use an in-home screening tool to decide if these services are necessary for your family. The Medicaid waiver is a part of the Medicaid law that lets the federal government waive the rules that are a normal part of the Medicaid program. By waiving these federal rules, states can offer long-term support programs that let families care for their children at home and participate in their communities. This also gives adult children a voice in directing their lives. Let's stop here and explain what we mean by long-term supports. Long-term supports are those programs and services that help a person live an independent life in an accepting community. Some examples include adaptive aids, home modifications, parent training and education, peer supports, respite, specialized equipment, and vehicle modifications. Your family may choose respite care as part of your child's long-term supports. You may have heard of respite care or personal care services and thought that they were the same thing, but these programs are very different. The main difference is that respite care is meant to give you time off from your caregiving duties to unwind, while personal care services are like having a helper in your home with you to do some of your child's daily living activities. Some families may qualify for both programs. It depends on your child's care needs. We've talked about the different doorways to Medicaid. In this section, we'll explain each of these doorways so you know which program is right for your family. This building shows the 7 doorways that children with disabilities and/or special health care needs may use to access Medicaid in Wisconsin. You might know these programs as CLTS, Title 19, CCS, Badger Care Plus, Supplemental Security Income, Katie Beckett, or Medical Assistance. Regardless of the name, these doorways all lead to the same Medicaid benefits. There are 3 different eligibility programs for children that all access the same Medicaid system. Your child can enter through the disability doorway with programs like Katie Beckett, through the income doorway with programs like Badger Care Plus, or Your child can receive Medicaid due to disability and income through the Supplemental Security Income SSI doorway. SSI is not a Medicaid program, but it gives you automatic eligibility for Medicaid in Wisconsin. There's one rule that's the same no matter how you access Medicaid. Proof of U.S. citizenship is required for all Medicaid programs. Badger Care Plus is the healthcare program for low-income Wisconsin residents. Children, pregnant women, and adults, including 18 to 25-year-olds who were in foster care when they turned 18, can apply. Families can apply online anytime at access.wi.gov or call 800-362-3002. And if you've applied in the past and did not meet the program rules, you may want to apply again since some of these rules have changed. Once you're enrolled in a Badger Care Plus HMO, you'll get a packet that explains your HMO, the enrollment process, and contact information. You'll also have 90 days after you've enrolled to change your HMO, whether you chose it or whether it was chosen for you. Supplemental Security Income, or SSI, is another doorway to Medicaid. It also includes a monthly cash benefit for those who are eligible. SSI uses two standards to decide a child's eligibility. First, the child's disability must be severe, reaching an institutional level of care. And second, the family's income must fall below the limits of a standard equation. Both standards must be met for a child to be eligible for SSI. The Katie Beckett program is one of the doorways to Medicaid for children under 19 years old whose disability meets the requirements of the Disability Determination Bureau and requires an institutional level of care. A standard evaluation called the Functional Screen Tool is used to see if the child meets the institutional level of care. This means that a child may have a disability, but not experience enough of a delay to qualify for Katie Beckett. Eligibility to Medicaid through Katie Beckett is the only Medicaid program that only looks at the child's income and not the family's income or assets. Long-term supports have eligibility standards that are similar to the Katie Beckett Medicaid program. To be eligible for long-term supports, your child must be living at home with your family and meet the institutional level of care in physical, developmental, or severe emotional disabilities. A fee may also be charged based on your family's income. The Functional Screen Tool is used to decide if your child meets the guidelines for Medicaid programs and long-term supports. It does this based on the amount of help that a child needs for self-care. There are a few other things you need to know about the functional screen. First, you can appeal the decision if your child doesn't meet the eligibility standards. Second, your child can repeat the functional screen again at a later date. The functional screen measures children's eligibility against the abilities of their typically developing peers. An older child, then, might gain eligibility because the ability gap widens as children get older. And third, you have the right to ask for the functional screen for your child, even if the screener doesn't think your child will qualify. As we mentioned, part of the application to CLTS programs is a tool called the CLTS Functional Screen. When you're talking with the person doing the functional screen for your child, it's good to be a little more realistic and a little less rosy. This means resisting the urge to brag about your kids even though it's what parents do. Instead, it's best to imagine that you're taking a great trip and you'll be gone for a month. What type of instructions would you want to leave for the person caring for your children to make sure they are safe and healthy? Would you be rosy or realistic? It's this type of detailed, realistic description that you need to provide when you're doing the functional screen evaluation with the screener. This has been a lot of information, and I think it's easier to compare things side by side. So here are the three programs we've been discussing. There are times when a child could meet the eligibility for more than one program. It is fine to be on both Katie Beckett and SSI, for example. Sometimes families experience variations in their income that bridge the limits required for SSI. In those cases, it's fine to be on Katie Beckett as well, sort of like a backup plan for emergency situations. This information will lead you to the next steps to apply for the Medicaid program. How you enroll your child for long-term supports depends on which county you live in. For most families, you will contact your county's Human Services Department and say that you're interested in the Children's Long-Term Supports program for your child. If you're not sure how to find that number, call the regional center to help you with this. For families living in the southeast, southern, and western parts of the state, you will need to contact Compass Wisconsin Threshold. Compass is a one-stop shop helping families with everything in this process. If you have more questions about Medicaid, these resources, ABC for Health, Aging and Disability Resource Center, Family Voices of Wisconsin, the 5 regional centers, the Medicaid Handbook, and Well Badger Resource Center, all specialize in different parts of Medicaid information for families. All of these groups are free to families and confidential. Here are several resources available to assist you in this process. The fact sheets can be found on the Family Voices of Wisconsin website at familyvoiceswi.org. Here are some web links to get more information about Medicaid. You can pause this presentation if you want more time to copy these links. In this section, we're going to look more closely at Wisconsin's Medicaid program and focus on managed care or fee-for-service, which are the two ways you might get program benefits. Managed care is a contract between Wisconsin Medicaid and private health maintenance organizations, HMOs, to give comprehensive or all-inclusive services. Managed care plans are responsible for ensuring access to Medicaid services through their networks of providers and are at risk for their financial costs. Children with special health care needs often need to see specialists, providers who focus on one area of health care, for more specific treatment. It's possible that your child's specialist isn't in the Badger Care Plus HMO provider network, or that the specialist is in another state. Your child can still see this provider. You will need to get a referral from your child's primary care provider. Then, as long as these providers accept Wisconsin Medicaid, your child's visit should be approved. Fee-for-service is a method that pays doctors and other healthcare providers for each service performed, like tests and office visits. There is no defined network of providers in fee-for-service. Members can see any provider who accepts Wisconsin Medicaid, even if the providers are in another state. As long as they accept Wisconsin Medicaid, your child can still see them. If you're finding that you have more questions than answers about Wisconsin Medicaid, there are people in the system who can help. An enrollment specialist is available to give you information on the enrollment process. Enrollment specialists are unbiased because they don't work for any healthcare agency, and they're knowledgeable because they only work with managed care issues. Income maintenance specialists, on the other hand, determine eligibility, offer information and referral, and offer case management duties for Wisconsin income maintenance programs like Badger Care. And finally, an ombud is your assistant and advocate if you are already enrolled in a program but have a problem or grievance. Ombuds know the appeals process and will help ensure your rights and responsibilities. For many services through Medicaid, a prior authorization is needed. This is also true for private insurance. Prior authorizations take place behind the scenes unless there is a denial or change to the request. Then parents hear about it. We want to explain how this process happens and what you can do if you get a denial. We all know that being denied a service is very upsetting, so we want to do all we can to avoid that situation and give tips if you get a denial. Medicaid or your private insurance may need a prior authorization or a PA to approve a medical service for your child. This is a really common process. A prior authorization is a written request between either your private insurer or Medicaid and the healthcare provider asking to explain why this service is medically necessary before payment can be approved. Not to worry, healthcare providers are used to giving this information. When Medicaid or private insurance has all the prior authorization information, a staff member will review it. The service will then be denied or approved with specific details like the time period or number of services to be covered. Medical necessity is a set of rules or guidelines used by the staff at the Department of Health Services to make decisions about prior authorizations. The definition of medical necessity is set by the federal government. States are allowed to add their own definitions as long as they don't contradict or are more restrictive than the federal government's. Wisconsin, like most states, has made its own definition. It's the roadmap the Medicaid staff uses when deciding if a treatment or therapy is necessary for your child. If a prior authorization is needed to get a service for your child, it's important to have signed release forms. A release form lets the provider and Medicaid or the insurance company share information. Signing these releases can get your child's services and supports faster and can help avoid extra tests and appointments. Providers can't give your child's information to anyone without a signed release form, even in an emergency. It's illegal. This is an important choice for your family, and you should think seriously about signing each one. Medicaid will often ask for a prior authorization for a service to make sure that there isn't a duplication or overlap of the services. Duplication may happen because a child's medical team is billing Medicaid for a service that's similar to a service that your child receives at school. The educational and medical goals must be different to have the prior authorization approved. Remember, school IEP goals must be educationally necessary, and community therapy goals must be medically necessary. It's helpful to share your child's IEP with their community treatment team to avoid any overlap. Let's practice. Is this a duplication of services? The community goal is Judy will independently transfer herself to the toilet and in and out of the bathtub, bed, and car. The IEP goal is Judy will move independently throughout the school building using a walker to attend classes on time. The answer is that this is not a duplication of services. The goals and the treatments used to reach these goals are different for both settings. Is this a duplication of services? The community goal is Eduardo will improve speech intelligibility. The IEP goal is Eduardo will be understood by his teachers. The answer is that this is a duplication of services. The goals and the treatments are both vague and seem to have the same goal, that Eduardo will be understood. Is this a duplication of services? The community goal is Keisha will strengthen and relearn how to use her right hand following surgery. The IEP goal is Keisha will independently complete classroom assignments using adapted writing instruments. The answer is that it is not a duplication of services. The objectives for Keisha are different at home, strengthen and relearn, versus school, independence and work. I thought that I should panic when a prior authorization was denied for a medical service for my child. It turns out that this may not be the final decision. You can appeal this decision by requesting a fair hearing from the state. A fair hearing is not like going to court. Many times, a fair hearing is done as a phone meeting and you're allowed to have someone present to support you. The important thing to remember is to focus your appeal only on the reason for the denial and to provide new or additional information that supports your appeal. Here are several resources available to assist you in this process. They can be found on the Family Voices of Wisconsin website, familyvoiceswi.org. Here are some web links to get more information about prior authorization and the coordination of care. Thank you for taking the time to watch this presentation. If you have any questions, please contact Family Voices of Wisconsin. Also, consider clicking the feedback button on this web page to give us information to help improve this presentation. Thank you.